So sorry for this interruption, there is some technical error. So let's continue. So need for anti-obesity drugs, as we know that it is a worldwide pandemic, so practitioners should consider drug treatment for adults only after dietary, exercise and behavioral approaches have been started and evaluated and a target weight loss has not been reached. Okay, so means drug treatment is secondary as compared to your lifestyle changes. Current status of FDA approved drugs. Currently these are the drugs being approved or currently used for obesity treatments: your phentermine, ORLISTAT, LIRAGLUTIDE, PHENTERMINE-TOPIRAMATE combinations, then NALTREXONE and BUPROPION combinations. Can you cite me the what group of the drugs is? Your LIRAGLUTIDE is GLP-1 analog, and topiramate is your anti-epileptic drugs. NALTREXONE is a opioid antagonist. So we will see one by one group of drugs. So coming to phentermine, it is a sympathomimetic drugs. Reduced food intake by causing early satiety. Okay, it causes early satiety. Listed by the FDA as a schedule 4 drug, approved for short-term use, that is less than 12 weeks. And since 1960, I have told you, 1959, most widely prescribed drug in USA, approximately 70% prescriptions for obesity treatment contains this phentermine. It is available in different doses, that is 50, 37.5 milligrams, and 8 milligram preparation has also been approved recently. Every drug has a side effect, so it is a chronic therapy you have to take for long-term periods. So there is some side effects like increased pulse, higher hypertension, nervousness, insomnia, headache, constipations. It is contraindicated in case of uncontrolled hypertension because it is sympathomimetic drugs, so it has several side effects related to cardiovascular system. So it is contraindicated in case of uncontrolled hypertension, active cardiovascular disease, glaucoma, anxiety disorders, concurrent use with monoaminoxidase inhibitors within 14 days. So if you are considering it to use with MAO inhibitors, then like your cheese reaction, like your serotonin syndromes, it can cause several hypertensive emergency conditions. So better to avoid MAO inhibitors along with these phentermine drugs. Limitations: FDA approval is only for 3 months of the treatment. Key features is lowest cost. Its good feature is that it is a low cost drugs. So coming to the second group of drug, it is ORLISTAT. So it is a pancreatic and gastric lipase inhibitors. Resulting fat malabsorption reduces net energy intake. Dose is 120 milligram 3 times daily or 60 milligram 3 times daily with meal. Safety record is excellent, means it has good safety profiles as compared to phentermines, which is sympathomimetic drugs having several side effects. And its side effect is that is oily stools, means fecal urgency, oil spotting, increased defecations and deficiency of fat soluble vitamins. Basically it reduces your fat absorptions, okay, from the GI tract lumen. That's why it is leading to most of the fatty contents being excreted through your feces. So that's lead to oily stools. Okay. So contraindication is malabsorption syndrome and pregnancy, and it will also lead to decrease in fat soluble vitamin intake or fat soluble vitamin absorption like your ADEK. Okay. Limitation is less weight loss and side effect, and best studied and lowest risk among the anti-obesity drugs. So it has long-term safety profile is there, except from this oily stools or fecal urgency. Next group of drug is liraglutide. It is a GLP-1 receptor agonist, glucagon-like peptide 1 receptor agonist. As you know that this is one of the drugs for as a anti-diabetic drugs. Okay. So it is known as incretin mimetics, works by increasing insulin release from the pancreas and decrease excessive glucagon release, slows the gastric emptying and promotes the weight loss. So these are the mechanism of action by which mechanism it is also effective in diabetes conditions also. So the dose is to start with 0.6 milligram subcutaneously for 7 days. Maximum dose is 3 milligram OT. Okay. So side effect is nausea, diarrhea, decreased appetite, and contraindication is family history of medullary thyroid carcinoma or multiple endocrine neoplasia. There are some reports about these effects of that it causes multiple endocrine neoplasia type conditions or thyroid cancers. Sporadic reports are there, so it is being somewhat contraindicated. So coming to next group of drug, that is phentermine and topiramate combinations. So it is a norepinephrine releasing agent phentermine plus GABA receptor modulation topiramate. So you are targeting two things. One is your sympathomimetic drugs, second is your GABA receptor modulations. So decreases appetite to reduce the food intake. Okay. So the starting dose is 3.75 milligram and 223 milligram. This is the range, orally once daily dose. Side effect profile, it is basically related to the topiramate leading to peripheral neuropathy, dyspepsia, insomnia and constipation, and similar side effect as that of phentermines. So contraindication is glaucoma, hyperthyroidism, concurrent use with monoamine oxidase inhibitors as like that of phentermine we have discussed. So warning is it can have teratogenicity effects, so contraindicated in case of childbearing women groups. Suicidal ideation, changes in memory, metabolic acidosis, hypokalemia and acute angular closure glaucoma are some reported side effects. As you know that rimonabant is a drug which has also been withdrawn from the market from the same suicidal causes. So you should be cautious while using this group of drug. So next group is naltrexone and bupropion. It is the opioid antagonist naltrexone, okay, and bupropion is dopamine and norepinephrine reuptake inhibitors. Okay, so it acts on the central nervous system pathway to reduce the food intake. Dose is 8 milligram of naltrexone and 90 milligram of bupropion, and contraindicated in case of uncontrolled hypertension, seizures and anorexia nervosa, chronic opioid use, and side effect profile is nausea, constipation, headache, vomiting. So warning sign is similarly suicidal ideation, increase in heart rate, hepatotoxicity and angle closure glaucoma. Okay, you can see this picture. This is naltrexone hydrochloride and bupropion hydrochloride, 8 milligram and 90 milligram. 8 milligram of naltrexone and 90 milligram of bupropion is available. So coming to central regulation of energy balance, the main part of central nervous system, that is arcuate nucleus, is involved in this, and you have medial neurons and lateral neurons among this arcuate nucleus. So medial neurons have, you can consider this into two categories, means two types of neurotransmitters are affecting these medial neurons. One is your POMC, pro-melanocortin hormones, and CAT, we have already discussed, cocaine and amphetamine related therapies targets. So POMC causes cleavage, it is cleavaged by prohormone convertase, produces melanocortins, binds to G protein melanocortin receptors, inhibits the food intake. I have already discussed it has anorexigenic effect, so it inhibits the food intake. And SCAT also, it acts as hypothalamic satiety factor, inhibits the food intake. Okay, so both these are anorexigenic hormones. They are affecting the medial neurons in the arcuate nucleus. Coming to lateral neurons, you have neuropeptide Y. It stimulates the Y1 and Y5 receptors, increases the food intake, means they are orexigenic. Okay, and agouti related peptide, they are endogenous antagonist for melanocortin 3R receptor and melanocortin 4 receptors, increase the food intake. So both these are affecting the lateral neurons in the arcuate nucleus and they are orexigenic. So if we will say that which is the primary site of central regulation for this energy balance, these are the primary neurotransmitters involved and these are the sites of brain where this regulation occurs. So coming to the different drugs currently in pipeline for this obesity treatments, you can may remember or may not remember, but you can have an idea about this. Means what are the targets which are being, for which drugs are being developed, like your neuropeptide Y5 antagonists, your belneprid. It has completed phase 2 trials. You know there are phase 1, phase 2, phase 3 trials. After phase 3 it has been found suitable, then it will come for application for drug approval from the regulators, and then after it will be used. So before this phase 1 and phase 1 trials, it should have to undergo preclinical trials, and currently this has completed phase 2 trials. Okay, that means it has shown some promising results in preclinical studies and phase 1 studies, and also it has completed the phase 2 and its result is awaited. Next group of drug is AIIMS-6545. It is a cannabinoid receptor antagonist. It has completed preclinical studies. Then RM493, it is a melanocortin agonist, so it is in phase 1b studies. Ghrelin vaccines, means some vaccines are developed towards ghrelin. It decreases action of ghrelin. It is in phase 2a studies. Somatostatin vaccines, it inhibits the growth hormones. It has completed preclinical studies. Adenovirus 36 vaccines, and it protects against the adenovirus 36 induced obesity, and it has completed preclinical studies. Means it is not only drugs are responsible for obesity treatment, some vaccines are also being tried for these obesity conditions. So vaccines are not only for your infective agents like measles, chickenpox, or DPT, whatever you are in your universal immunization schedules, but you can say that vaccine therapy is also applicable for endogenous substances which are present in your body to exert their effect, like your ghrelin vaccine, somatostatin vaccine, adenovirus vaccines. Okay. So coming to anti-obesity vaccines, some more details about them. Ghrelin, it is a orexigenic hormone secreted by fundus cells of the stomach. Decrease in food intake, decrease hypothalamic orexigenic signals, and increase energy expenditures. This is the effect of ghrelin vaccines, which is counteracting the ghrelin hormones. So no weight loss seen in human clinical trials of these vaccines as per the results, but let us see what are the next trial is saying about its effect. Coming to somatostatin, it is a peptide hormone which inhibits growth hormone and insulin-like growth factor 1 secretions. So its vaccines will lead to reduced growth hormone secretions, has been associated with obesity and increased adiposity. In animal studies, and vaccination did not affect changes in food intake, means there is dubious result about these vaccines. Adenovirus 36 is associated with obesity and inflammation and increased adiposity. In animal studies, vaccinated mice had greater reduction in body weight and decreased inflammatory changes in fat tissues. So let us see which vaccine is coming to market after its approval. So coming to summary, so you have abnormal or excessive fat accumulation that presents a risk to the health. For adults, WHO defined overweight and obesity as follows, that is, overweight is a BMI more than or equal to 25 and obesity is BMI more than 30. Short acting drug, long acting drug, you have short acting your phentermine sympathomimetic drugs, and long acting you have ORLISTAT, LIRAGLUTIDE, PHENTERMINE-TOPIRAMATE and NALTREXONE BUPROPION combinations. And coming to side effects, as it is a sympathomimetic drug, so it has several cardiovascular side effects, and sometimes if you are taking it with MAO inhibitor drugs, they can lead to hypertension emergency conditions. And if you will take topiramate like antiepileptic drugs, like antiepileptic drug, antiarrhythmic drug, they have their own tendency to cause the same disease condition also, because they are altering the pathophysiology behind this disease. So if you are taking antiarrhythmic drugs in a higher dose or in a unintended dose, this will lead to arrhythmia. Similarly, epilepsy, anti-epileptic drugs, this if you are taking it in a different dose as per prescription of the epilepsy, it will lead to seizure-like conditions, because they are affecting the channels, they are affecting the GABA receptors, GABA functions. So, but for this obesity treatment, you need to take them for a continuous basis or for a long-term period. So there is chance of some side effects. And liraglutide, your anti-obesity drugs, which is been tried here. Orlistat, as you know that it has the long-term safety profiles except for oily stools. Okay. And among these, most of the drugs are given orally, but except liraglutide, which is for parenteral route of administration, subcutaneous route of administration. Even in diabetes purpose, it is also given subcutaneously. Coming to oral route, these are the drugs being available. Okay, so this is about your anti-obesity drugs, and these are the drugs being in practice till now. Let us see what are the new group of drugs is coming, which is having very minimal side effects and can reduce the weight significantly. Because you know that anti-obesity drugs, they lead to only 5 to 10% body weight loss till now, what has been seen, and there is a weight regain problem is there. If you will stop these drugs, there is chance of weight regain if you are not maintaining the sufficient lifestyle activities or changes. So along with this anti-obesity drugs, lifestyle modification is a must. You have to do physical exercise, you have to reduce your diet intake, you have to change your diet patterns. Along with that, this can substantiate, this can have add-on effects. Okay. So this is about your anti-obesity drugs. So let's close this